It's time for the 1430 Connection on 1430 WNAV and 99.9 FM, spotlighting news, newsmakers, and important community issues. Now, with this week's edition of the 1430 Connection, here is WNAV news anchor Donna Cole.
Welcome to the 1430 Connection. I'm Donna Cole. Speaking with me today is Dr. Nilesh Kalyanaraman. He is our Arundel County Health Officer, and thank you so much for joining me today.
Thank you, Donna. It's good to be here.
We're in the midst of the coronavirus pandemic. Dr. Kalyanaraman, you studied at Yale University. You got your doctorate in medicine from SUNY Brooklyn. Did you have any thoughts of anything along these lines ever happening during your lifetime?
I started in medicine in 1999 and so saw SARS in 2002 up close and H1N1 in 2009 and MERS. And each of those had some similarities to what we're seeing, but ultimately didn't go as far as we're seeing with COVID-19. And, you know, I've heard about the 1918 flu pandemic, but I think all of us have been reading a lot more about it since COVID-19 came onto the scene.
Do you think because we're more global now, because more people are traveling, because it's tougher to keep things under control in a specific area, do you think that's why this has been so different than any of the others that you mentioned?
I think that's a really, really important point to touch on, is not just sort of our global connection, but also our density. And there's more and more not only opportunities for this to happen, but also opportunities for us to understand what's happening and try to get on top of it as well. 30, 40, 50 years ago, something like SARS or MERS, we just probably wouldn't have heard about it as much or had as much to be able to offer. So we're also in some ways, both conditions are causing it to happen more often, but we're also a little bit better prepared to deal with it as well.
I'm sure you've watched this or maybe something along these lines. Bill Gates' TED Talk from April 2015 called The Next Outbreak, We're Not Ready, which predicted exactly what is happening today.
You know, I haven't seen that, but I've actually read about that TED Talk, and I think that this is our challenge in public health always, in that prevention means being prepared and being constantly vigilant, and that can be hard when it feels like there are a lot of pressing issues that are, you know, of the now. And thinking back to 2015, 16, 17, we were seeing the opioid crisis really break in our communities. And so how do we keep our attention both on the short and the long term? It is a constant challenge, not just in public health, but in society.
So prevention means being prepared and being constantly vigilant. We were woefully unprepared for this on a global scale, not just in Anne Arundel County. I'm not pointing fingers, but we were woefully unprepared, yes?
To be just very honest about this, I think that we were in different countries have shown different levels of preparedness and different levels of action about this. In the United States, a lot of decisions flow from the federal level, and there were delays in acting at the federal level that ripple out across all the states and counties. We talk about the lack of availability of testing. The reality is those are federal decisions that now reverberate. In terms of PPE, it's a term that now people are very familiar with, the personal protective equipment. Shortages throughout the country mean that each county is fighting with each other, and that's not a situation anybody wants to be in.
States are, bidding against one another. It's crazy.
It is crazy, and it serves no useful purpose, and yet here we are. And so I do think to some degree there was also an opportunity to act quickly that wasn't seized on. I will tell you that Maryland is one of the states that moved really quickly, and I got to tell you that I'm really proud of how fast we moved in terms of our social distancing, in terms of infection control and closures, and I know that in the next few weeks we're going to see a lot of the results will help us determine the course in this state. But I believe that quick actions were a really key part of how we're going to be doing better than some of the other states didn't move as quickly.
That social distancing, that quick action, that doesn't mean that we're going to be in the clear in a few weeks.
No, it does not. It doesn't mean that we're in the clear. And the thing to remember about all these moves were they were meant to slow it down, not to stop it. And the reason we can't stop it is people still have to interact. But by slowing it down, it gives us time to do a few things. It gives us time for healthcare system to be ready for the increased number of cases. It gives us time to get more tests online. It gives us time to get PPE in place. And it gives us time to just better understand what's going to happen. So this is not a weeks-long process. This is going to go on for months. What it looks like, we still have to see and make decisions about, but it's not a short event.
All right, we're going to take a short break. We'll be right back on the 1430 Connection. Welcome back to the 1430 Connection. I'm Donna Cole. I'm talking today to our Anne Arundel County Health Officer, Dr. Kalyana Raman. We're in the midst of this novel coronavirus pandemic, and though we've been socially distancing and though we are hopefully ordering as much stuff as we can to our homes, all of this is making a big difference, but this doesn't mean we're in the clear. So let's talk about what will get us into the clear. And there's three things I want to talk about: herd immunity, vaccinations, and treatments. So which one do you want to start with first, Doctor?
Well, we'll go in the order that you brought them up.
Herd immunity.
Herd immunity is the idea that if enough people in a population are immune to a particular, and in this case, this virus, that the virus just doesn't have anybody to transmit to. And so you don't have to get to 100% immunity before you see transmission stop. So things like the flu, you see about a 90 to 93% herd immunity, which means that if 90 to 93% are immune, the other 7% are very unlikely to get anything. There's just nowhere to pass it on to. So in this context, that means that that if we can slow it down and people get the virus at a slower rate, that gives time for herd immunity to build up. And so it becomes even harder for the virus to transmit because as we go along through time, more and more people are now immune, which creates barriers to its transmission. So that's another piece of slowing it down that's critical, and I'm glad you brought that up.
Vaccinations, how much time are we looking at for that? Is that a year away? And I know you do not have a crystal ball.
I don't. Obviously, there are groups around the world that are moving really fast on vaccination, including here in Maryland, at the University of Maryland particularly, at the medical center there. But vaccines typically take 12 to 18 months to develop. And so from our planning perspective, we're planning, hopefully, if all works out, that we would see a vaccine in about a year. We are happy to be surprised if it comes sooner than that. But we're trying to plan for what has happened in the past and how these timelines work out.
And we already know there's trials already. There's a trial in the state of Washington. But in order for these vaccinations to come to market and to each one of us, they have to be safe for us.
The first part of vaccine testing is that they have to be shown to be effective in a test tube or petri dish. And then the second part is to make sure that they're safe, and they use healthy volunteers just to make sure the vaccine itself doesn't cause problems. And only once they do that do they see if it's even going to be effective. And so it has to pass all of those stages before a vaccine can even be considered for general use.
Moving on to the third part of that question, treatments. What are you seeing that works? What are you seeing that doesn't work? And what should people not do right now with what they might be hearing in public?
That's a great point about what should people not be doing. There's obviously a lot of talk around treatment, and we are hopeful that that actually probably has a shorter timeline, mainly because we have drugs that already exist that are being tested, in addition to new drugs that are being tested. And really the key here is something that's similar we talked about with the vaccines, is to make sure that the drugs are not doing more harm than good. One of the things we hear is why not take whatever medication it is. And the reason for why not is that anytime a medication is prescribed, you want to make sure that the benefits outweigh the risks, or that the person is in severe enough condition that you're willing to take those additional risks. And so it's not as simple as why not. It's also, the real question we ask is why take it? Is it really going to do something? We're hearing a lot about hydroxychloroquine, and it's really quite unfortunate that we're hearing about it the way it's being pushed as a cure. It's not. There's no evidence at this time. If there are studies that show it is, I can assure you that we will be adopting that wholesale if it's shown to be that way. But a lot of drugs have failed at the last step of, does it really work? But we also know that there are trials going on with new medications, with existing medications, and we're really hopeful that in the upcoming months something shows efficacy. So we ask particularly that people not hoard hydroxychloroquine or other medications that are touted as a cure. We know that there are people who need those medications now, people with lupus and rheumatoid arthritis and other such conditions who can't find the medications they've been prescribed because of this. So please keep that in mind as we talk about these things, that there's also people who need these medications now.
Governor Hogan recently directed the Maryland Department of Health to begin publishing everything on racial and ethnic breakdowns on COVID-19 cases. The 75% of the currently available data, which he calls troubling disparities, and points to a persistent public health challenge that we must address. In other words, people of African American background are at a much higher percentage of showing infections from this virus and deaths from this virus. Yes?
Yeah, that's what we saw in the release of the Maryland state data, and we have some preliminary data in Anne Arundel County that we're seeing higher rates of African Americans with testing positive for COVID, but we're still trying to gather the data. It's one of those situations where we're trying to figure out how do we pull the data out of the databases, and so we're hoping to be able to have a better sense of the information that we can share with the public on this.
So we're going to take another quick break. We'll be right back on the 1430 Connection. We'll continue discussing this part of the problem with coronavirus. Welcome back to the 1430 Connection. I'm Donna Cole. I'm talking today to Dr. Nilesh Kalyana-Raman, our Anne Arundel County Health Officer. So we're talking about this disparity, which seems to be showing a really unfavorable issue with African Americans being at such a higher percentage for being sick with the novel coronavirus and dying from it. And you're saying that you're trying to pull out the data for Anne Arundel County right now.
Yeah, we're looking to pull out the data, but that doesn't really stop us from acknowledging that it is an issue in the county as it is throughout the state. We know that, and we're actually quickly moving towards what we can do to identify what those challenges are, what the gaps are, and then figuring out what it is we need to do to address those health disparities.
And this isn't isolated to just this virus. This is an ongoing issue with many things. I mean, I, as a breast cancer survivor, I know for one that African American women are much slower to be diagnosed with breast cancer, and by the time they are diagnosed, it's more often than not in the later stages. So that's a problem there. With so many things in the medical system, there's an issue with this. Why is that?
There are a number of reasons for that. Health equity and particularly racial disparities are something we've seen across across the entire healthcare system, to be quite honest. There's multiple factors to that. One is systemic racism, just where healthcare is in terms of accessibility, attitudes within healthcare, in healthcare writ large, issues around continuous stress from racism and other societal factors that are disproportionately placed on African American populations. And then there's also just historically there's been issues with the healthcare system and how African Americans have been treated. And when we look at health equity, we talk about race and ethnicity and issues with African Americans, but we also see disparities with other ethnicities, and we also try to look at what the disparities are along income lines. So we also see lower outcomes amongst poorer populations, and sometimes these things overlap as well. So it's a really complex area, which argues for us devoting even more attention to it to make sure that we address it.
With these issues with not having enough ventilators, not having enough test kits, tests available, with not having enough PPEs, how are we in Anne Arundel County? What are we short of? Do we have enough ventilators here in Anne Arundel County?
That's a tricky question to answer. We have a lot of ventilators. I've been in conversation with our two hospitals, Anne Arundel Medical Center and Baltimore Washington Medical Center. They have significantly expanded their capacity for care, including the number of ventilators they have on hand. And the state is also putting into place a way to, they're purchasing ventilators and a way to allocate those ventilators to the institutions that need it. In terms of PPE and test kits, those still aren't at the numbers we need, but there are active and ongoing efforts to buy more. I know at the county level we're working on buying more. Each of the hospitals is doing that. The state is doing that, so that's an ongoing effort. Trust me, it makes us nervous, and we are acting on it.
The test right now, is there a priority for first responders and healthcare workers for testing?
Yeah, so our prioritization is for those who are hospitalized, for healthcare workers, and then for first responders, people in congregate facilities, so nursing homes, assisted living facilities, group homes, shelters, those who are over 65, those with chronic illness, and then after that is anybody with symptoms. Our goal is to be able to test everybody with symptoms, but right now we're mainly focusing on those first two categories. And once we get to testing everybody, I think we'll be in a better position of being able to determine how far it's spread.
And what tests are we using right now in Anne Arundel County? Is it still the ones that are taking 3 to 5 to maybe 7 days for a return on the results, or do we have the 1 hour, the 5 minute? What test do we have here?
Yeah, it depends. Each facility and each organization is using something slightly different. So in the drive-through testing sites we have, those are taking typically about 3 to 4 days at this point. It's getting better. We hope to see those days come down. The hospitals have the ability to do testing a little bit more rapidly, and including getting results within a day. I know that there are some facilities that are looking for the rapid tests, the ones that give you results within an hour. So pretty much what we're seeing is a good amount of variation, just depending on which lab company each facility is using.
And are there false positives?
As with any test, there are false positives, but it's a small number of false positives. And the implication for people is that they're still going to have the symptoms, and most of our, if not all of our guidance at this point is around staying home, taking care of yourself, and if you're not able to, and you need to be hospitalized, then that's fine. But since there's no targeted medications at this point, it doesn't really change how we're going to handle somebody's case.
The USDA said in the wake of a tiger being positive for COVID-19 that we should distance, for those that do have the virus, should distance themselves from their pets.
The issue of pets, we're starting to same sort of thing. And just as a sidebar, one of the interesting things about COVID-19 is that I've never been part of anything where we're developing information so rapidly and so publicly. And so a lot of the change and uncertainty people feel is from that rapid change in information. Animals have tested positive for this. It's the tiger at the Bronx Zoo, but also I think a study of cats in Germany. And so we're starting to think that maybe it's best to essentially treat pets as you treat people. If you're sick, try to keep away from your pet. If your pet is sick, try to keep it away from others, people and other pets. And that's probably the safest way to try to approach that.
Well, I can't thank you enough, sir, for joining me today on the 1430 Connection, and please stay well.
Thank you. It was good to be here, and you stay well as well.
This is Donna Cole on the 1430 Connection. We will see you next week.